Hello, my name is Amber Morales, and this is my presentation on effects of exercise programs in colon cancer patients undergoing chemotherapy for kinesiology 3347. This article was published in May of 2016 into the Journal of Medicine and Science in Sports and Exercise, Volume 48, Issue 5, page 767 through 775. The researcher was Anne M. May, who has a PhD at the Julius Center of Health Sciences and Primary Care, University, and at the University Medical Center, Utrecht in Netherlands. I don't know if I pronounced that right. Sorry if I did not. The link is posted below if you would like to view the article. Globally, colon cancer is the third most common cancer in men and the second most common cancer in women. The colon cancer prognosis has improved in the last decade, which is really nice to hear. And in the Netherlands, they have a 5-year survival rate. And then, due to the increase in number of colon cancer patients, they wanted to do this study and see how we can benefit and see why. And this article was really stood out to me because my husband has stage 4 colon cancer, and so I would like to know if exercising can help him out or not, which I think they can because he still goes to work every day. But anyways, I digress. So the patients undergoing treatment, under chemotherapy, a big side effect is fatigue. They're always tired due to that drug. So they're wondering if exercise during treatment might be helpful. And so that's how the physical activity during cancer treatment, the PACT study, was created to help investigate a short and long-term effects of fatigue. So this is a random trial. 33 colon cancer patients who are receiving treatment did undergo this study. 21 men and 12 women. Patients were randomly selected for 18-week supervised programs or usual care. A primary outcome was fatigue measured by the multidimensional fatigue inventory and fatigue quality list, and a secondary outcome was based on quality of life, physical fitness, anxiety, depression, body weight, chemotherapy completion rate, and the outcomes were based on a post-intervention in 18 weeks and at 36 weeks. So the multidimensional fatigue inventory and fatigue quality list was used to measure fatigue, as I stated before. The multidimensional fatigue inventory consisted of 5 subcals: general fatigue, physical fatigue, reduced activity, reduced motivation, and mental fatigue. And their scores ranged from 4 to 20, with 20 being the highest in fatigue, and the results were very, very reasonable. For the fatigue quality list, had 4 subscales: frustrating, exhausting, pleasant, and frightening. And patients had a list of adjectives to help fit their fatigue. Scores ranged from 0 to 100. And the quality of life was measured by a European Organization for Research and Treatment of Cancer Quality of Life questionnaire. And scores also ranged from 0 to 100. The participants aged ranged from 25 to 75 years of life. They had to be able to read and understand Dutch. They had to be able to walk 100 meters or more. And then after they consented to this study, they were randomized into a 1-to-1 ratio. And then before they were recruited, a histology diagnosis was completed 10 weeks before. Patients were supervised by a physiotherapist in the 18-week exercise training. Patients attended twice a week for 1 hour with a 10-minute warm-up, 40 minutes of aerobic and muscle strength training with a 10-minute cool-down. And on the days that they were not there, they were asked to do 30 minutes of exercise a day. And exercises were fit to the patient's fitness level to see what they could do, not to overdo them. And heart rate was measured during their aerobic training. And in the end, it appeared that colon cancer patients undergoing treatment during the 18-week survival was safe and feasible. The intervention at 18 weeks decreased the physical fatigue and decreased the general fatigue at 36 weeks. And although the results turned out to be okay, they still wanted to do a larger population and see if it's still true that it helps decrease the fatigue with the larger number. And this wraps up my presentation. Thank you so much.